Where we're using manual therapy around the hip, because we have a large joint, it's often useful to use a webbing traction belt just to assist your hands a little bit. So if you're doing small range movements or small range mobilizations, grade 1 and 2, you may well be able to use your hands, but where we're coming up to grade 3 and 4, a traction belt can be quite useful. So what I'm going to do is to use a lateral glide movement. So the longitudinal glide movement was the one that we did gripping our leg into this position. So longitudinal glide is simply a traction position but performed as an oscillation rather than a continuous pull. But the lateral glide I'm using is to flex the hip and to move into this position. So when I'm doing low grade movements, I can use my hands. Now, in terms of privacy, that patient places her hand here, I'm locking my shoulder against her upper thigh, and then I'm gripping down towards the groin, and I can slowly lean back, gently oscillating the hip joint itself. If I want to impart more force, I'm going to use my traction belt, and I'm just going to place that around the thigh. If you could just pull that into the groin, that's fine. And then that comes round. I adjust the belt so I'm taking up the slack. The belt goes under my hips so that it doesn't slip. I'm supporting the knee, one foot goes back, and this hand is simply monitoring the movement of the hip. And as I lean back, I'm oscillating that position. So that's my lateral glide mobilization, and once I have performed that and I've modified symptoms, if flexion was the painful movement, so drawing the knee towards the rib cage was painful, I can now repeat that movement with the lateral glide, and I'm performing a mobilization with movement. So an MWM to hip flexion. So I'm lifting the foot up, I'm drawing the hip into a lateral glide position, and then I'm leaning towards my leading foot so that I'm not bending my spine. So we've got a combined movement of lateral glide with my hip flexion. And in some instances you may need the patient in shorts if you want skin contact, but if you're doing that, then the belt needs to be padded with a towel, or you can just use clothing to protect the skin. So that's the lateral glide technique leading into a mobilization with movement, combining lateral glide and hip flexion.